We're going to get started. Let me first, this is actually our second time we've done this. This was kind of a COVID thing, our happy hour webinar. Oh, here we go. We got a whole bunch of people. Well, first of all, let me say happy Friday. Welcome. You know, this is a happy hour. It is 5:30 on Friday. I hope this is a successful webinar, not just for the beauty industry, but for also the alcohol industry. I don't know about you, but I have my after patients wine here. I may be 4 in already, but this is actually my first glass of the weekend. And we're going to make this a recurring tradition. I want to first hear, okay, Chicago. I want to hear some from where some people are from. We have Chicago. We're going to get like Australia, a lot of international people. You're in an Uber coming from LaGuardia. That's good to hear. I'm going to want to hear what people are drinking in a moment. So, you know, what are we going to talk about today? I'm going to keep you for about 30 to 40 minutes. I'm going to try and be as entertaining as possible. We're going to talk about beauty news, future of aesthetics, hot trends, new technologies, what's going on at PFrank MD, and we are going to answer some quick fire questions. I'm going to do some polls so you could see how people answer questions in the beauty industry. Bomb-ass Skin is in the house. Thank you for joining. Jersey's in the house. Someone's ready for a cocktail. North Carolina. Look at all that stuff. So let's first go to the first poll as other people come on. I used to do this event, including live events, just for beauty editors, but the fact of the matter is the social media audience and my patients seem to really enjoy this. So I hope you enjoy it too. We have a record-breaking number of people who signed up for this. Let's get to our first poll. If something doesn't work, this is completely Olivia's fault. Okay. Mom, Amy out there, you know, I want you to be proud of your daughter, but if something goes wrong, she's fired. Okay. Let's go to our first poll. Let's see. And it should come up on your screen. What are we drinking tonight? Are we drinking wine? Are we drinking non-alcoholic beverages? Is it going to be a quiet weekend? Hard liquor. I don't drink fluids at all. Or how about I'm thirsty, but I'm not able to get a drink? Let's see what we got. Non-alcoholic beverages is winning so far. I guess people are going to keep it light this weekend. We have a little bit of wine. We have a little bit of thirsty. We're going to give it a few more seconds. Chantal, always love seeing you. St. Louis is in the house. St. Louis, I know you. Megan, thanks for joining. All right. It looks like non-alcoholic beverages is kind of winning. Well, let's see. Hopefully we'll be able to, you know, as the weekend goes on, get back to some enjoyment with beverage. We're back. Okay, cool. So most people should be on right now. Let's first talk about alcohol. I always talk about alcohol in my pro-aging book and on the podcast. I think abstinence from alcohol is the new sunscreen. You go to dermatologists, all you constantly hear about is sunscreen. What's your favorite treatment? Sunscreen. What's the best way to prevent aging? Sunscreen, sunscreen, sunscreen. But what people don't realize is that alcohol, as much as we all love it, I'm drinking it right now, is probably just as bad for you in terms of aging, right? In the short term, it makes you puffy. It dehydrates you. In the long term, it decreases your elasticity. It makes you puffy. It dehydrates you. It decreases elasticity of the skin. And like smoking, chronic use of alcohol definitely weighs in on aging. Now, if you think about what is moderate to severe alcohol intake, remember, if you're drinking 7 or more glasses of alcohol a day, you are officially a heavy drinker. It doesn't matter if you do it once a day or whether you have all 7 in a weekend. So if you are a heavy drinker, you are definitely doing yourself a huge disservice. I don't believe there are studies, but in my opinion, it is as bad as sun exposure. It causes 7 different types of cancer, and it's just plain not good for you. That being said, we only live once, everything in moderation, including excess in the pro-aging playbook. And as long as we just accept that it's like kind of one of the evils of life that we like to imbibe on and enjoy on every once in a while, then we can find that balance. It's when we forget and we just drink haphazardly, often when we don't need to or when there's social pressure. This is when people really get into problem on the long term. It's really the only drug that's bad for you that people will make other people feel bad for or uncomfortable for not drinking. So moderation of alcohol It's the new sunscreen. Stick to it, guys. You will see a difference. So what's going on at P. Frank MD? My Lord, it feels like it's nonstop here. We did finish the renovation of the Uptown OG space on 86th Street and 5th Avenue. We expanded. We're doing great down in the West Village. We're actually about to start renovation on another space on this floor, so we're going to continue expanding. We have Dr. Yang, Dr. Landau, Dr. Jake for longevity in the house, and a whole slew of expanding nurse providers that are really an amazing reflection. Thank you, all of you, for being part of P. Frank MD. I only have two hands, and you are definitely the extension of my octopus. Great development. The Pro Aging Podcast is coming back. We are going to do season 3. I'm very excited about the first cast. My friend who better be on here, Jessica Matlin. She is former beauty director of Bazaar. She's amazing, and we are going to talk about the future of beauty. She's been in the industry for a long, long time, and I think it's a good way to get started. So let's get to the trends. I'm hoping that the editors are now on board. Let's talk about some of the things that are just going on in beauty news. First and foremost, I think we could all agree, whether it's in the news or whether it's on social media, we are seeing an enormous polarity of ideas, right? No one's in the middle. No one wants to balance anything, whether it's social issues or politics. The same thing is going on with beauty. I like to call this the Morpheus 8 effect. You're really only reading trend pieces in a lot of beauty magazines, usually by not experienced beauty writers. I work with a lot of amazing beauty writers in the industry, but there are a lot of people that dip their foot in the game and that don't know much of what they're talking about. And what they're doing is they're either writing everything in a totally glamorized style, kind of like a puff piece, or they're then bashing it. And like with anything in the world, there's always two sides to every story. Morpheus 8 is one of these devices where it's like a non-invasive facelift. People will very commonly get very disappointed. It can be a painful procedure. And although it's a very effective procedure, it does not give you a facelift, people. It does not melt fat. And now we're starting to see all these opposite end discussions where all of a sudden you're seeing these terrible stories of people who are, in pain, damaged skin, so forth and so on. So this polarity in beauty is just as prevalent as in any other form of news that's out there. Another big trend, fear of injectables. I think one of the most common things when people come to me now is, often in New York, I always say in LA, people tell you what they want or who they want to look like. In New York, people tell you what they don't want and who they don't want to look like. And one of the most common themes we're seeing right now is, I don't want filler, or I don't want injectables. There's this fear out there now, particularly fillers. And I'm kind of glad that this fear has finally come upon, because there's been this enormous over-commoditization and abuse of fillers in the industry, mostly due to med spa culture. There actually has been recent FDA warnings talking about use of IV medications, fat-removing injectables, and injectables in general, where people are getting hurt in unregulated environments that are not sterile, with complications that are going unattended without physician supervision. So this has been a real problem, but it's good that people have a healthy fear. That doesn't mean that just because there are abuses and risks, it doesn't mean it's not good. So people are afraid of looking bad. They're afraid of filler fatigue, where the skin gets stretched and they lose the elasticity. People are fearful of migration, thinking that filler may walk out of their lips to another place of their body. And this just does not happen. And most of these complications and the things that people are fearful of with filler are not from the appropriate use of filler. It's from the abuse of filler. So there's nothing in beauty or in anything in life that's going to be all bad or all good. So most of the things that people are fearful are the abuses. And I always tell people, you only notice the bad work. You don't notice the good work. The whole goal of doing cosmetic alteration is that you can't tell that something was done. A recent line that I say to all my patients in trying to explain all this, which gets kind of convoluted, is, just because someone has bad style doesn't mean the rest of us shouldn't wear clothes, right? There's a lot of bad work out there, and this over-commoditization has become a really common problem. A lot of the use of fillers, there's nothing wrong with enhancing a cheekbone, a chin, a jawline, but really what we're using filler for is to reflate, not inflate. When you inflate, you're stretching the balloon. You're putting pressure on the elasticity of the skin. And this is a problem of a lot of young people. Their skin is so nice and elastic when it starts out. You could shape and mold the face, and it would give the appearance of bone structure. But over time, 35, 40, 45, that skin just gets stretched out, and you are an earlier trip to the plastic surgeon for a facelift. This is called the Kardashian effect. But the real issue that I think everyone is afraid of with fillers is what I like to coin med spa face. You all know what med spa face is. That looks just like chronically puffy. It's that face that is kind of overly contoured and round, or even square. It's just like a misformed face. And it's where people start looking the same. It's like this ageless image that almost kind of makes you look older. They are like 25-year-olds that you can't tell what age they are because they just have this med spa face. And to coin the term med spa face, unfortunately, a lot of this over-commoditization where they're just selling by syringe and more is always better. More is not always better. There is such a thing as too much of a good thing. And the most important thing a physician can do or a provider can do is say the word no. There are a lot of other options to help keep you look young, and this med spa face is really something we want to avoid. There are a lot of faces as we get older that aren't candidates for filler, where we'd rather subtract rather than add, right? And there's so many injectable sparing technologies, whether it's heat-based devices like Ultherapy, Thermage, or threads, or newer devices like Ellacor, or just go for a facelift or an eye lift or a brow lift. There's so many great things. I love sending patients for surgery. It doesn't mean that small amounts of injectables like Botox and fillers, neuromodulators aren't necessary. It just means a conservative amount will give the patient what they used to get from it when they used to do a small amount of injectables and feel great about themselves. So it's nice that people are catching on to a healthy fear, but we're definitely going to avoid med spa face. And there is an art. So many of new patients that come to me now, particularly around 40 to 45, where all of a sudden they say, I'm resistant to Botox, I'm resistant to fillers, things aren't working for me like they used to. It's not that you're resistant, it's just your anatomy is changing. You can't exercise or eat or drink like you did when you were 25. So once you get to those middle years, you have to kind of change up your game. It doesn't mean that you still can't do them. You just need a little bit more of an expert hand and judgment to figure out that balance. And for a lot of these patients, I really have to reverse them down. I have to sculpt them down. And that's by using reversal agents to melt the filler, to use injectable sparing technologies. And there really is an art to doing that, whether it's the lips, the cheeks. It's often done in stages. Rome wasn't built in a day to getting med spa face, so it's certainly not built in a day to reverse it. But transforming back into someone so they recognize themselves again is really a satisfying thing to me. And the treatments to really give that unnoticeable look of youth and vitality, I think, is ultimately the goal for everybody. Let's get to another poll here. Okay, people are digging my Kardashian effect. Yeah, like that. Okay, let's go to the next poll. So what are your attitudes towards injectables? How do you feel about them? I won't do them. They're not for me. Okay, here. Not totally against them, but nervous about the risks and looking fake. I like them, but they don't work for me like they used to. Or afraid, the more injectables is always the better. It's funny, people will quit drinking not for the way they look. They won't quit for what it does to the rest of their health. All right, gang, let's see. Doesn't sound like anyone's against them, but a healthy amount of fear. All right, let's end this poll so we could just get a quick idea. We share those results. People aren't against them, but they definitely have a healthy fear now. Some people just really don't care, and they just want more. It's better. I hope they're not my patients, but there is something being said for a little too much is too much. Let's keep moving on, guys. I don't want to lose you. It's Friday night. Let's talk about innovative practices and the way that we perform these type of things. One of the common fads that I'm seeing these days have to do with microdosing. And microdosing is not just for THC and edibles and magic mushrooms anymore. We are actually microdosing injectables. You see, back in the early days, in the early 2000s, when injectables became good, more was always better. The question was, how long could we get things to last, right? And now, when I tell my patients, when they ask me, how long is this session or whatever I'm doing today going to last, I say, that's not really the question you want answered. What you want answered is not how long things are going to last, but how often do I need to see you? How many times a year to keep you looking the way you're doing? Because, right, just like when you dye your hair, you want to color in roots. You don't want to dye it and then let it grow out and then dye it all over again, right? You want to do little bits at a time. And we're noticing more and more with injectables, challenging the body with smaller amounts of neuromodulators, smaller amounts of fillers. Sometimes it could be as little as a half a syringe at a time. Patients will get a more natural result, a less traumatic result. They will look more consistent. They will be less susceptible to complications, whether it's vascular occlusion, filler fatigue, all these things. Same thing with neuromodulators, little bits at a time. I mean, I do have a lot of red carpet type of patients, and they will come every month for very tiny amounts. And as you get older, where you tend to have more of the issues with injectables, this may be a much better scenario. This is a testament to a failure of a relatively new drug called 𝐷𝒐𝒍𝒏, which has been in the tube, in the pipeline for several years. It took many, many years to come to market. It was supposedly a longer lasting Botox, but unfortunately it was also more potent in many ways and exacerbated and prolonged some of the complications of frozen face, heavy brow, things of that type. And, I don't know many providers that regularly use 𝐷𝒐𝒍𝒏 because first and foremost, it doesn't last that much longer. It's twice the price 𝐷𝒐𝒍𝒏. And I really find if someone is looking for the most natural look, doing less more often is the best. Microdosing, also a testament to this is the popularity of a lot of these skin boosters that are out now. You've heard of Profhilo from Europe. SkinVive is the allergen product that's out on the market, where just hyaluronic acid is very uncross-linked, very dilute. We're just putting it in the top layers of the skin to create a plumpness, a hydration. Even though it seems like it's a relatively new to market thing, we've been doing skin boosting for a very long time at 𝑃FrankMD, and a lot of other providers have been doing this. By using just dilute amounts of hyaluronic acid filler. We do this with AquaGold. A lot of my patients of mine that are out there, we actually create a slurry of hyaluronic acid and neuromodulator like Botox in a microneedling device with saline. And we're able to microneedle it throughout the skin, creating that kind of skin boosting vibrant effect. My nurses do this all the time. It's great before events, helps shrinks the pores, changes the reflection of light on the skin. It's really great. So much of all these things have to do with not what you do, but who you're doing it with and how it's done. So choosing your provider is obviously the most important. Fortunately, we're now finally seeing all these FDA warnings of these illegitimate places. Listen, there are a lot of great physicians out there. There are great nurse practitioners, but it's really all about the appropriate supervision, the appropriate experience, training, and the comfort level that you have with an experienced provider. But let's go to interesting kind of poll that I wanted to hear people share. So let's see. How do you choose your cosmetic provider? This is a ranking thing. 5 means it's the most important thing in choosing your provider. 1 means I don't really care about it that much. The first one is, I don't want to travel for injectables. Proximity is the most important. Second is pricing. The cheaper, the better. I go by price. Word of mouth. I need to know people who have seen the work. I want to see it myself. They recommend me. It's a word of mouth thing. I only care about what Kardashians are doing or what other celebrities are doing. If it's good enough for them, it is good enough for me. Let's see what y'all have to say about that. End the poll, and I'm going to share the results. And it appears that some people really do care about proximity. Price does not seem to be the important thing, but there are a few people, right? Price is always an issue to some degree. Word of mouth seems to be the most important. And I think that's true. You want to know someone who went to someone, you want to see their work. Celebrity endorsements don't seem to matter. I'm glad to see that this is going out, because I will say people are realizing now that a lot of influencers are paid. And fortunately, influencers are supposed to say when they're paid by something. It's nice to see if someone who looks great is using it and it's someone you see on camera, right? That's great. You don't want to see a celebrity that doesn't look good that's endorsing something. But it's nice to remember that people are paid for this. And training and professional complications. I hope you're not just telling me what I want to hear, people, okay? Because training and knowing someone's in a cosmetic specialty is certainly going to be the most important. All right, let's get back to it, people. We're moving here. More emerging technologies. One of the most common questions I get in skincare is about exosomes. exosomes, exosomes, exosomes. It's like the new buzzword. It's the new stem cell. It's the new PRP. It's the new growth factor. And it's the new hope in a jar. It's something that physicians are starting to use procedures. You're going to start seeing this in skincare. But like all the other things I mentioned, there's a lot of hope in a jar. There is first and foremost right now, like zero regulation on it. So you have no idea what you're getting. It's not like you're buying a product from Estee Lauder that has research and like, regulatory agencies overlooking their labeling and things of that nature. And you don't know what's getting in the bottle. There's very little research. There is suggestive data, but there's not really great human studies. And like PRP, like growth factors, and a lot of other things, let's see if this comes to fruition, because most of these things tend to be faddish. There are plenty of things that do work. So let's not just jump on things that may be a waste of money, right? You know how I all feel about PRP and skincare. For hair growth, it's great. For joints, it's great. I'm not really a big fan of it. And just adding dollars to someone where there's really no evidence other than causing trauma or complications in the benefits of PRP. And I just worry about this with exosomes. So I'm not going to add something new just to jump on the fad. There are risks to all these things. Exosomes are these vesicles, these extracellular vesicles that cells release to help communicate in between cells. And they can create DNA, they can contain DNA, essential lipids, proteins, all these things that can be beneficial, but we don't know. They can cause cancer also. There were concerns about growth factors in the past in skincare leading to basal and squamous cell carcinoma. And for everything that can potentially have a positive effect, there's also the potential for negative effects. So exosomes, I'm curious, I'm listening. I'm not regularly using it in my practice. There are plenty of other things that work. Let's do another poll. I want to keep you guys awake. We're not far from being done here. Thank you for words of wisdom, people. I appreciate it. Skincare. We're going to talk about skincare. All right. How do you feel about it? Do you try new anti-aging ingredients when they're released? Okay, I want to know, are you on top of your skincare game? You have an extensive rotation of the hottest products? Do you stick with your skincare routine? Do you think it's all hocus pocus? I want to tune in on this too. And I'm too busy to work on my tan to think about skincare, okay? I want you to give yourself a shout out if you're proud enough to answer this one. Doom, 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 doom. Let's see here. Okay, I think we're ready. Let's end this poll. It looks like there are a lot of people who have an extensive rotation. Doesn't seem like there are many people laying in the sun. My feeling is there's a lot of hocus pocus. If a skincare routine serves you and makes you feel good about yourself, something that's very common is that people constantly changing. You're putting new chemicals, new preservatives, new everything. Like, that's the wrong thing to do. If you like your skincare, stick to it. Don't keep trying new things, people. Stick to the things that work for you. Sensitive skin syndrome comes from overuse and abuse of skincare. So avoid the hocus pocus. Like all things pro-aging in my book, Rule of KISS, keep it simple, stupid. If you don't have problem skin, don't use it. And please, 22-year-olds, other than sunscreen and moisturizer, all these like 16-year-olds, they want to get involved. They're like hanging out at Sephora, buying skincare stuff. You're just challenging your skin with things that could hurt you in the future. Enjoy your youth, protect your youth. Sunscreen, skin cancer, cut down on alcohol, right? Abstinence is the new sunscreen. Okay, let's move forward. Okay, just to quickly talk about updates of some procedures. You've heard about mFace, you've heard about ELICOR. These are the two hottest technologies of last year. mFace, the electrical stimulation device and synchronized radio frequency that improves the non-injectable improvements of architecture of the skin. It works to tighten the muscles. It's not going to give a facelift. It's not for 70-year-olds who've never tried anything, but for young and middle-aged people that are looking to stimulate the muscle in a permanent way to put things back where they were and give you back some definition without having to use injectables. mFace has been hugely popular. And the question that everyone always asks is, what about the neck? And we finally have the new submental handpiece, which stimulates the platysmal. How am I doing? I used it. Kind of like forces the mu. Is that the right terminology? The mu, right? What the device does is strengthen that muscle, melt some fat, tighten some skin. The 𝒚face device has really been awesome. I'm super excited about the neck handpiece. We have the forehead for the brow lift. We have the jawline to lift the corners of the mouth and cheek. And now we have there. 𝐸LaCore. 𝐸LaCore was a very hot device last year. I still think it's amazing. It's not a procedure that a lot of people are using. It is a surgical device. It's not for your average dermatologist or plastic surgeon who dabbles in non-invasive stuff. It is a minimally invasive dermatologic surgery device. And that's why I love it so much, because it actually does something. We've learned a lot in its upgrades of technologies. This device removes cores of skin, whereas things like Morpheus 8 are needles that puncture the skin and deliver heat. This actually punctures out cores of skin. The holes close up in about 24 hours, and it takes about a week for the tissue to heal. And what we found is using less aggressive treatments with more treatments than the older advice. We used to say like 2 treatments. Now we're saying 4 treatments, but less aggressive. We're finding really no complications, much less complications of prolonged healing, much faster closing the holes. People are able to put on makeup a day later. We're able to treat darker skin types. We're able to treat all over the body. So I have a lot of patients who are younger looking to avoid facelift for little bits of skin or early stage jowling. It works great. I use it a lot on post-surgical patients. They had a facelift 2-3 years ago. They're getting some reaccumulation around the mouth or in the submental area. It works great for that. Post-tummy tuck, post-lipo, above the knees, the elbows, the décolletage, the crepey skin on the arm. Really, I'm doing as much on the body as I am on the face. And this kind of evolution of the use of this minimally invasive dermatologic surgery device is really amazing. And the fact that it takes a certain skill and it's not something that your average med spa or general dermatologist doing is really a niche that I really love in my practice. So that and the 𝒚face. All right, let's talk about one of my favorite things to talk about, body sculpting. What is in and what is out? Let's first talk about what is out. Non-invasive fat removal is finally going out, what I call the cool sculpting effect. After finally body surgeons, body contouring surgeons talking about and warning about the effects of cool sculpting and its ability to potentially cause fat to grow or cause ridging or uneven fat removal, what we call shark bites. This was something that it wasn't common, but it happened often enough that body sculpting surgeons were constantly correcting these things because so many people were getting cool sculpting that were not candidates. But again, the commoditization in the med spa industry, everyone from people who had a pinch to obesity were getting several rounds of cool sculpting and getting all these problems. With the lawsuit of Linda Evangelista, I'm not going to go into it. You guys all know about this. It doesn't mean that these devices didn't work. I still have them in my office. They're still relevant, but they're for teacups, people, not soup bowls, not gallons. And a lot of people who want fat removal have at least soup bowls or gallons to remove. Finally, non-invasive fat removal procedures are put in their place. You can only burn so much fat, only so much garbage in your backyard before you just have to cart it out. So what is in? The resurgence of body contouring and liposuction. With Instagram, there's a lot of attention before and afters. A lot of people are doing these like major mommy makeovers, tummy tuck, breast lifts, lipo, 3D abdomen, all these different things. It's made people feel more comfortable with the safety and efficacy and the look of this type of surgery. But there are a lot of people who are still looking for a lot simpler. A lot of people don't have muscle repair needs. A lot of people don't have hanging skin. They just have areas that are resistant to diet and exercise, and they don't want to go through the full general anesthesia mommy makeover type of thing. They just want a procedure that's going to remove those areas resistant to diet and exercise. And this is the procedure that dermatologic surgeons like me have been performing. I've been doing it for 25 years. My mentors before me since before 2000. And the technical term, tumescent microcannular liposuction, or microlipo. And it's just a way to remove fat under local anesthesia. Patients take an Uber home. They have a 24 to 48 hour recovery. It's a stitchless procedure. You wear a garment for a week. There's no exercise for a week, but most patients are back on a beach in 2 weeks, and you are seeing dramatic differences. I always say I'm the last 10 pounds, not the first 10 pounds. I can make you look like you lost 10 pounds in the right spot in a simple, safe, awake, painless procedure where people can take an Uber home. And this micro lipo has always been my favorite procedure. It's really an art form, and it's actually become more and more popular since the cool sculpting effect has occurred. Now, I know what a lot of you are saying. Everyone's taking Ozempic now. Everyone's taking Mounjaro now. Why does anybody need lipo? Well, guess what? When you lose weight, a lot of people don't lose it evenly. And you're not going to emaciate yourself to get your dad's love handles gone or bra fat gone that you inherited from your mother or arm fat. You want to get close to your ideal body weight, but people come in different shapes and sizes, and that's okay. The goal of tumescent microcannula liposuction is to just kind of give people more symmetry, whether they're a little big or a little small, doesn't matter, but people tend to want more of a symmetric body. So even plus size models, they just tend to be a little plus everywhere. Some people are pear-shaped. Some people just have little spots of annoyance. And this is really where this procedure is great. And I do this in my Uptown surgical facility. I love it. And again, this is called the Ozempic effect because you're always going to have those little areas that just don't seem to go away. All right, we're almost done, guys. I want to hear about what you think about fat removal procedures. What do you think about them? You've tried them before. I want to try them before. I have too much in some areas and not enough in others, but I'm wary about doing everything. I'm just afraid. Liposuction, like that old Discovery Channel thing with big baseball bats. It doesn't have to be that way. Little fine microcannula instruments the size of a Q-tip. We'll give this another few seconds, and then we're going to go to some questions. How are we doing on time? Look at that. I'm doing so well, Olivia. Aren't we doing well?
So good.
Okay, I'm going to knock off some great questions, see what people have from the audience. All right, let's end this poll. Let's end it. And let's share it. So people have tried them before. Some people are interested. And some people are just lucky. Everything was just put in the right place. Aren't you just lucky you get to eat whatever you want and just always look good? Fortunately for me, most of the world isn't like that. So we're always aspiring towards something. Let's stop sharing that. And, I think it's time. I think I covered most of what I wanted to talk about. I speak fast. I know you can follow me up on Instagram. Let's go to some rapid fire questions. I'm going to take a rapid sip of my wine. I'm so impressed. There are still some people out there. Let's go to these questions and I'll see what else shows up. Okay. Oh, look who's back there. A little blurry. Okay. Can you do lipo on your stomach at age 62? My skin will sag, regardless of pregnancies or not. It has nothing to do with age. It has to do with your elasticity of the skin. If you have pendulous hanging skin or saggy belly button, you are in tummy tuck land. A lot of people, I have patients that are 70 that have pretty good elasticity of the skin. And if the skin's not hanging, it will retract. So best to get a consultation. Someone asked me, what are best treatments for the knees? A lot of treatments for the knees. There's no such thing as a knee lift, right? Everybody just wants to kind of like lift up their leg and like pull the thigh up. You can't even do that with a thigh lift. If there's irregular fat depositions, we could use biostim injections. If it's mild crepiness, things like Morpheus 8. If you actually need redundant skin removed, Ellacor.
Why do patients have only tumescent liposuction recover quickly than patients with a tummy tuck or breast lift?
Why do tumescent liposuction, why do they recover quicker? Why? Because when we do it, it's under local anesthesia. We're using very tiny instruments, so the trauma is very little. When you're doing lipo with a tummy tuck and you're under general, the instrumentation is very big. There are drains, there are stitches. It is a much more traumatic procedure, right? The more you get beat up, the more the recovery.
Recommendations for filling in the lower eye without filler.
You can't fill without filler, and no, PRP does not work. I'm sorry, it does not work. It causes enormous bruising, enormous post-inflammatory pigmentation. Patients come to me, they spend thousands of dollars trying to get rid of the brown ring from PRP. It does not fill. You can do CO2 laser around the eye, it will tighten the crepiness, but if you have hollowness under the eye, some sort of filler, either temporary or permanent, like fat. Oh, I like the next one.
What do you most often talk to your patients about?
Well, I don't know what I most have to talk to my patients. What do I have to talk them out of? Doing more. If patients like something, they like the filler and the neuromodulator I put in, or the laser, or whatever it is. They go, well, let's do more, right? People get greedy. And talking them out of doing more and say no is the most essential thing I do in my practice. There's always something else to do. Doctors are afraid that like they say no and it's like they're going to lose the patient, but there's always a workaround if you have a full palette and armamentarium of treatments for a patient. So talking them out of filler. Does CO2 combat sun damage? It does combat sun damage. All forms of Fraxels do, right? It does decrease your risk of non-skin cancer. What else you got, Olivia?
I got a 3-part question.
Okay.
Is there a way to keep filler from migrating outside of the lip border?
You can keep it from migrating outside the lip border by not trying to stuff a size 5 foot in a size 3 shoe, okay? If you try and overstuff your lip, it's going to migrate, okay? If you overstuff a balloon, it's going to take the path of least of resistance. Put small to moderate amounts of lips at a time. You can build it slowly, but that's how you get overfilled. What's number 2? Someone cheated. They asked too many questions here.
What are the procedures we can do that don't melt?
Oh, I can't stand this. Everyone thinks heat-based devices melt facial fat. They do not. You know what melts facial fat? Aging. That's what melts facial fat. Only if you have a complication of a heat-based device like thermage, Ult therapy, or a million other ones is it going to melt fat or even filler. Now, yes, you may want to be cautious about using some heat-based devices over filler that is placed superficially, but you're really not melting fat. I don't believe there's been enough evidence to suggest that. I haven't seen that in 25 years of using heat-based devices. Hit me.
Given the recent popularity of Ozempic and weight loss, there have been rumors circulating about potential premature
aging from Ozempic face. Okay. Who invented Ozempic face? That's such a great term.
I'm not sure.
I think I do that. I think I talked about that, right? Anyway, Ozempic face. Listen, it has nothing to do with Ozempic. If you lose weight too fast, you're going to lose collagen. You're going to muscle waste. You're going to lose fat. Weight loss, no matter what manner of which you choose, has to be slowly, 1 to 2 pounds a week. Anything more than that, you're going to be in like ketosis. You're going to be burning muscle, protein, all these things. Okay, what else you got?
Should 𝐈𝐧𝐻 be done yearly for maintenance?
Depends. 𝐈𝐧𝐻 is a great acne laser. It's one of the great innovations from Cutera that we use for patients who don't want to go on Accutane. You do 3 treatments. It does something permanent to the sebaceous glands to shrink it. It works. I like it. It's not ideal on hormonal acne. And there is always some maintenance. It really depends when you grow out of it. A lot of my patients do a series of 3, and depending on their severity, they'll do 1 or 2 treatments a year.
What is the best for tightening and lifting jowls? Would M-Face work, or would you recommend Thermage or
if you really have a jowl, we're talking about a jowl. We're not talking about a little laxity. The non-invasive stuff's not going to work. You can combine a few of these things, you'll get an improvement. Sometimes it's just time to go for surgery. Oh, I love this next question. The 3 letters.
PRP?
PRP. What are your thoughts on PRP for older women? You need collagen to build collagen. And if there's anyone that PRP is not going to work for, it's going to be older women. If there's any suggestive evidence that it's going to work for, maybe younger people. But again, unless I'm using it for hair growth, which I do believe it works, particularly in perimenopausal women.
There's one question that someone asked in the chat about SkinVive. Your thoughts?
SkinVive, I mentioned that earlier. SkinVive is that skin booster. It's a very dilute, uncross-linked hyaluronic acid that is being placed superficially in the skin. Again, it's nothing new. It just happens to be the first FDA product for that purpose in the United States. But any provider could take any hyaluronic acid on the market. I like the hyperdilute Belotero and place it superficially in the skin for plumping, fine lines, hydration, changing the reflection of the light. Not a big fan of the SkinVive agent, but again, a lot of people just want to use an off-the-shelf FDA-approved things. We use a lot of things off-label, and we concoct our own mixture and dilution of neuromodulators and other forms of injectables. And we're going to find what's best for the patient here at 𝑃FrankMD. So that's my feeling on SkinVive.
The last question: threads or Alcor?
Ooh. Okay, well, the main difference is I love threads. You know, we're going to do a real thread journey.
Yeah.
We're going to do a thread journey. I promise you. Okay. Because I do love threads. People, again, it's the polarity. It's all great. It's all terrible. Threads are not going to remove skin. They will shift tissue like a couple of millimeters, which is a lot for people in their 40s. But for a lot of people in their 50s and certainly older, there's excess skin. And when there's excess skin, you have to subtract, not add, not shift. And that's where the Alcor is great, as is surgery, right? Surgery is always an option. I love sending people for surgery. And I think, did we cover it all?
I think that's it.
Look at that. Thanks, Olivia.
Thanks, Dr.
She just had to get in the screen. I'm so proud and so happy that I have the people that are interested in what I have to say on the gram. Keep liking, keep sharing. As long as you keep putting your ear and your finger to the phone, I will keep talking. Okay. Thank you, everybody, for joining at this happy hour webinar. Cheers. And I'm out.